And thanks, Joe, for that summary. I tried madly to write everything that everybody said, and I scroll down, and it'll take me a long time to do that, so I won't. But I thought the workshop went extremely well, in part due to the fact that all of you were here and were engaged the whole time, and that we really achieved the goal of bringing health system leaders, working with researchers and patients to somehow achieve the vision of the learning healthcare system. But we have a lot of issues to deal with. And some of the remarks, especially by Jim at the end about the glass, we're going to have to do this work within the glass because you can't just completely destroy the glass or all the liquid falls out. So part of the challenges I think you all face and we all face is taking these ideas about what we saw of very fine exemplary organizations which even themselves admit that they're not achieving their aspirations, that they have trouble with regulatory requirements, that they've found methods to prioritize research, but they have to be nimble along the way. And as we heard earlier this morning, there's a limited amount of energy that our systems face. And so to me, the word that keeps coming up is this whole issue of alignment. And I think that's where PCORI is really going to change the game in ways that nobody else can do it, at least in our system today, because you've got patients, you've got investigators, and you've got systems, and you've got a federal government which has, as I think David said, it's got to solve a problem, and each one of us that works in a system has essentially the same problem that the feds have, which is how do we take the triple aim and not pick out our aim of the day, but actually achieve all three. I think we have a ton of work to do on the regulatory side, and that is going to have to proceed apace. And I think it's going to be a bubble up activity that's going to save the day. And I think patients are probably much more the honest broker in solving this than are researchers. Every researcher I know wants to have less work when it comes to regulatory governance of their work. And that's human nature, but patients really have skin in the game, and I'd welcome the patient advocacy communities to get busy on that. I also think that we in the system and researchers need to heed the call of if we don't address the needs of patients, patients are going to address them without us. And I thought that Ray's comments and examples of patients like me are, and it works. So there probably are lessons to learn from that. For those of you in the CDRNs, there's a certain amount of blocking and tackling that I think has to occur first. There's just a lot of work. And what I think this workshop and its successor is designed to do is to make sure that that work proceeds with the system that you're working with, not just with Joe and PCORI and Rachel and PCORNet and Rich, but bringing the systems along or actually being led by the systems as partners. I don't think PCORNet will succeed, will be sustainable unless it's driven by the questions that matter to the CEOs and that matter to the patients. We're sort of in the middle, I think. Somebody's got to work with the board, keep the lights on and the doors open, and make sure there's a little bit of margin to grow and invest. But more importantly, we have to serve the public. And I really like the theme that came out when this panel was talking about where's the magic spot. And it really is in the altruism and advocacy for patient well-being that governs our profession. And it's not just the professionals that are in it because they see altruism as an end in itself, but it's really all of us that work in healthcare. So stay tuned for the next workshop. I think, where's Catherine? But later this week, and maybe later today, you're going to get a brief email survey to ask some questions that won't take more than 5 minutes, but we're going to try to see what you think in a sort of systematic way about value and some of these issues that have come up today. It's less about obstacles, but a little bit about obstacles, and be as verbose and as thoughtful as you wish. But we'd love to see a nice response to the survey. And thank you all for coming. Michael.